Welcome to our newest episode of the Lebanese Physicians podcast. And today we will be discussing a cloud-based software for dentistry. And our guests are the founders of Oryx Dental, Khaled Saleh and Rania Saleh. Welcome, Khaled and Rania, to the podcast.
Thank you for having us.
Thank you.
We've talked offline before. I know you from before, and we've talked offline about your company and how you developed it. So Rania, you were a full-time dentist in the past, and Khalid, I think you were a software engineer, right, based out of California, and then moved to DC afterwards. But how did you guys decide to start the company? So what was the background of like changing your lives and starting this company?
I was a practicing dentist, and I had a pretty successful practice that grew to multi-locations, many associates, multi-specialty. And then I got pregnant with twins, and I had to go on bed rest. And I was never thinking about creating a dental software. Kay at the time was working with a software company doing HRA and some healthcare development. And I always was fascinated by what they were doing on that side of things, but I never thought about it. So I got pregnant, I had to be on bed rest, and my practice started declining drastically. The reviews that we were getting were not the same. The treatment plan acceptance was declining. Patients were not coming back, and I didn't know what was going on. And I realized that my systematic approach, my evidence-based approach to things was only implemented when I was in the practice. And I started thinking, how do I get everyone in my practice to get to the exact same diagnosis and then go through the treatment protocols that we have established? And this is not a common theme in dentistry at all. It's different from medicine. It's that like every dentist is kind of on their own. And I asked Khaled to help me. Let's create that software. Let's put it in a format where if these are answered, this is what would come out. If we have this risk, this is what we should propose to the patient. And it started just as an idea for my own practice to get it back to where I wanted it to be. And this is how the whole idea of the software started.
So basically, it's like when life gives you lemons, you make lemonade. So basically, you were on bed rest. You had maybe people covering your practice while you were gone, but it was not the same. It was all dependent on you per se, and you wanted to do something where you streamline the process, and the process would not be dependent on only one person, and maybe it would be a better and elevated level of functioning for the process itself.
Exactly.
So what was lacking, I guess, what did you find was lacking in dentistry practices that led you guys to create this software at that time?
I would say most practice management software were not built by dentists, and this is kind of our logo, built by dentists for dentists. They were built by people that were trying to sell them equipment, like larger companies. So the whole clinical module was an afterthought. So it was mostly book an appointment and send the paperwork to the insurance company and get paid. And the clinical module was super small. And my thought was like, this is the most important part of a practice. This is where we spend most of our day is communicating with the patient. So why can't we create a software that would give us a great engagement with the patient, a greater level of communication, a great exam, evidence-based, and then the whole insurance scheduling, all of it comes after, but it's not the core of the software.
Yeah, so basically it's more of a clinical-centered software or a patient-centered software rather than just an administrative-centered software as other companies were producing at that time.
Right.
So Khalid, you had the background to develop this, I guess. So basically, also it was probably hard for you. Like, you probably had a job at that time, and you had to maybe start a new company, which is a pretty scary process. So can you take us through this process of how you helped implement this company and software?
Right. So at the time when Rania went on bed rest and the kids were born after, the company I was working for got acquired, and I was kind of in between. And when I took off from the company, I kind of stayed away and I did not go to the company that acquired us. So I kind of was in between jobs. So I kind of started doing this full time when we took this one on. Initially, I was by myself, so I was doing most of the coding, and then I hired a couple of engineers to help. I have a special background in back-end development and building large systems that can scale. But obviously, like I don't have all the skills that are needed to build the system. So we started hiring the DevOps of how would you even run the system on a production environment, and how do you scale it, and how do you monitor it, and how so as we started to grow, we started hiring engineers in different areas where we needed where we were lacking, and we kind of built up the team that way.
Okay. Yeah, it's a big undertaking, and I bet you had to maybe like raise money, right? And continue to raise money to keep the process going over time.
We funded the original project from my practice sale and from Kay's exit. So that was our original seed money, and you always think you're going to go to market much faster than you actually do. But we were able to get to a point where we started selling to dentists our first version of the software fairly quickly. So we didn't have to raise for a very, very long time. And then we did a very small round from users only.
Okay. Got it. Wow. All right. That's impressive actually that it worked so fast. And that means probably you found a deficiency, I guess, in dental practices that you were able to market upon, I guess, afterwards. But I guess, I mean, to look at you both, it's like it was just alignment. You were on bed rest, your dental practice was going downhill because of that, and then Kay was like between jobs, so it's like the perfect alignment to start the process. So can you tell us, because Oryx Dental is a cloud-based dental software, right? Am I correct?
Right.
So how does that differ from like traditional dental softwares that are not cloud-based?
So there are a few. We're not the only cloud dental software. There are a few cloud dental softwares available, but most dental offices are currently running on-premise software. You'll have to have a server running inside your office. You'll have to have all the imaging stored locally in the office. You need to have all the security, cyber security protected for your office. So the complications of running a dental office using on-premise software is getting more and more complex just because of how the technology is changing. You have, for example, like the ransom attacks that happen on servers. We have one client, for example, where she actually got attacked by a ransom virus. They encrypted all of her database. She came into the office one time, and then she couldn't do anything. So she ended up actually paying them money to decrypt her database, and then she was able to access her system and see the patients. And immediately after that, she signed up with us. So it's the landscape is changing, and then we're seeing a lot of movement from on-premise to cloud.
Okay. So basically, one of the major things you're telling me is that it's probably more secure to be on a cloud-based software than you would avoid these attacks or cyber attacks on your dental practice that could happen.
Right, that's one aspect, like backups. If you store it inside your office, you have to worry about your own backups. You need to have your own IT specialist in the office. So if you're doing it on the cloud, you're outsourcing all these services. I mean, most likely you pay your IT company as much as you would pay like for a cloud software, if not less.
Right.
Uh,
So basically, you're running the IT part of the process. So it's one, it's you're streamlining the process because you're offering the full continuum of services that are needed, and at the same time, like you remove the headache, I guess, from the dental practice itself to worry about like backup of the data and to worry about like the IT things that could happen.
right, right. We make the process simpler for sure.
And so what are, I guess when the dental practice moves from like the traditional to the cloud-based software, so we talked about some of the benefits, but we talked also about so what are the benefits to the clinical practice in terms of like what is the clinical component of this software that is not offered, let's say, by a lot of other software that's out there.
I would say the biggest advantage they see is the risk assessment that we have created. So, in a traditional dental practice, and I'm sure you've been to the dentist, they look in your mouth, they tell you this is what you need. You go to the front desk, they're going to print out a treatment plan with some prices, and they're going to say, when do you want to schedule? And you don't really fully understand the picture or why you got these recommendations. And that was the frustration that I read from most patients. What we created is a very systematic exam. So you go through a 7-minute exam, and automatically the risk assessment is generated for the patient. The patient is walking out with a document that has their own photos, their radiographs annotated by the AI. They understand that this decay is getting deeper into the tooth. They understand why we're recommending a crown. This can be shared electronically, or some people print it out because they see that patients go and share it with family members, with friends, and they get more patients that way. So in one way, the patient is really understanding what's going on, their condition. So there's a better communication with the patient. That's the first impact that offices would tell us, that we're getting more referrals. We're getting patients calling us asking, my friend got that risk assessment. I want to get the exam that gives me that. And then they tell them every exam gives you that. So patients are excited about it, and they see an increase in their production because there's more case acceptance.
Yeah, so basically what you're doing is you're actually leveraging AI too into the process in terms of like giving the patient explanations and maybe images of what's going on in their mouth and how to treat that. Uh, uh, and so that, I guess, helps streamline the scheduling process and also helps streamline the insurance process because one, patients are more accepting of this, and then you have more notes that the insurance company would probably approve what the doctor is doing because then they would understand immediately without like somebody having to submit like written notes or whatever to the insurance company. Am I correct?
So we actually leverage the whole process, not just on the clinical side. And just like you mentioned, the dental insurance companies want the forms in a certain way. We preload that form. So the software is going and looking for the annotated radiographs, is reading the note and picking the part that is needed, and is creating the whole claim with all the attachments included. That's typically 20 minutes of time from each team member. It's doing all the eligibility ahead of time. A lot of the tasks that were manually done in the office, we leveraged AI to automate.
Got it. And this is a question for Khaled, I guess. So the AI component, are you using an outside AI company, or are you guys do you have that as part of your company? Uh, the AI component of the.
So right now we're doing both. We host our system at Google. So we work very closely with Google on some of the AI models that we're using, and sometimes they'll bring an outside partner that they work with. We will work with them on one project. And right now we're starting to build our own AI team in-house. But initially, like we did not want to start the process by building our own. Like I wanted to, to go with someone who has done it a few times before, that they have some good experience with it. And since we're working with Google, that was like an easy, like it just made sense to go in that route initially.
So yes, this is a great continuum of services. But one thing we discussed earlier was the safety and security and privacy of the data. So how do you ensure that in your practice? How do you ensure? Because I know like each practice has, if they have their own IT person, then they're responsible for the security of their software. But you probably are responsible for security of multiple practices at the same time. So how do you ensure that the data and the privacy remain safe?
So we do a few things. One, for example, like we restrict access to like the offices when you log into the office's realm. We restrict access by IP address, for example. So now they would configure their IP address. They'll say, if I log in from this address, which is the office, I can log in without using two-factor authentication. If I log in from the house or somewhere outside from my phone or whatever, if I'm traveling somewhere, then the user would need to log in using two-factor authentication. So then this is when you've seen this one before, I'm sure you'll get a text message, or we use the Google Authenticator app. You'd have to find the code, you enter it, and then you're allowed access to the system. This is one part from the user side. From our side, we use, for example, Cloud Armor to protect our all of our systems. So if we get a denial of service attack, for example, we work with the Google team on that. On the backend systems, the servers that we have are the access to them it's restricted to one machine, actually. Like the way to access our systems, you have to go through that one machine, and that machine is very, very secure. It's multi-factor authentication. Very few people have access to it. So this is how we build the security of how we access the system. And on top of it, like on the back end, when we store the data for the patient data, all of our databases, the PHI fields are encrypted. Each database has their own encryption keys. All communication between servers happen over secure encrypted channels. So it's so we do what we have security experts that we work with, and sometimes from Google we will like if we have some questions about security, we have a contact. I can ask them, and they can bring on their security experts, and we can work with them.
Excellent. And have you guys done like a cost analysis, let's say for practices? Like have you been able to save money for practices? Because as you were saying, they might not need as many employees anymore to do this regulatory stuff and insurance stuff. So have you shown that you've saved money for these practices?
We have it in two different ways. The first way is like the direct cost saving by not having a lot of third-party services. So when you have an on-prem software, you're not paying much for the software, but you're paying for all the ancillary features that you start buying, and there's overlap between some of them. So there's about 70% cost saving going with us and not having to pay the IT infrastructure, changing your servers, paying for all the additional add-ons that you typically would get. So anywhere between 50 to 70%, but 70% for most cases that we save. We did a case study with one multi-practice group that moved to our software, and they were making they were making 700,000 across 7 locations, so about 100,000 per location a month, and they jumped to 1.4 million. And it was the way everything got standardized for them. So this is one of our big success story, but I would see the production increase in most practices. The efficiency in collecting is huge because you're saving a lot of time for the employees. So they're able to have this better connection with the patient. They're able to do more meaningful work rather than call the insurance, get the breakdown. All of that is done automatically for them. Let me spend 20 minutes to send that insurance claim. They're able to use their employees more efficiently to create that report with the patient. And when the patient understands what's going on, they're more likely to say yes to treatment, to become a loyal patient, and to refer more patients. So every practice we've seen, I would say we see an increase in their production.
Nice. Yeah, so basically it's increase in production, better efficiency, better contact with insurance, and maybe improved quality of care for the patients. And the patients maybe perceive a better quality of care because they understand what's going on. Uh, so this is a massive undertaking, I guess. So how many employees do you guys have? And like, are they located in one office sitting together, or do you have employees like all over the place?
We crossed 100 employees, and it's all over the place. Me and Kay are in the same office,
Yeah.
or in the same home. A lot of our employee base is remote. We have some that work in clusters, and we're finding the collaboration when people work together is amazing. So we're trying to create more cluster areas to get people together.
Excellent. And I heard too, because you guys lived in Beirut for a while, and I heard from you that you also have a big cluster of employees in Lebanon right now. Is that correct?
Yeah, we do. I mean, the American University of Beirut has some of the best engineers out there. They have an amazing AI program, so we leverage that, and we have some employees in Lebanon. We have in Europe, Canada, and the US.
Excellent. So you're also helping, I guess, people in Lebanon get potentially good paying jobs over there, which is a great thing in addition to what you're doing. Uh, so my next question for you is like, how many practices are you servicing right now, and how does the future outlook look like? Because also I assume there's probably other competitor companies that are starting to spring out right now. I don't know. I don't know very much the dentistry part, but maybe.
Yeah, we crossed 2,000 dentists, so that was a big milestone for us. We're the fastest growing cloud software company on the market. So there are competitors, but we're doing really well. We have a very low churn rate. So people that come stick with us, refer us other offices. And just like I said, like in the office, the best patients are the ones that you get by referrals. It's been the same for us. 80% of our users are referred.
Okay.
We haven't done a lot with marketing or sales. It's mostly word of mouth referrals.
That is great. And I assume most of your services right now are in the US. Are you planning to expand your services to other countries? I know it's probably harder because maybe there's some different regulatory stuff, maybe different insurance issues and stuff like that, but I don't know if you're planning to do that.
So we right now we're available in the US and Canada.
Okay.
This is where we sell most of our clients. We have some clients in scattered around, like New Zealand, and but mostly we're focusing now on the US and Canada, just because of the software is in English, so we need to stick to English languages for now. And like if you go to Europe, like like dentistry changes completely, so it will be very difficult to. There's some countries like obviously we will not go after, but. But at some point there is a chance where we can go in other countries, Spain, for example.
You're not only serving the 50 states of the US, you may be serving the 51st state of the US too.
Yeah, I'm Canadian, so I'm American and Canadian, so I'm a bit torn between both, and Lebanese, of course.
So yeah, thanks to you both for being in this podcast. I mean, this is a great story. It's like I think when people, a lot of times people like get hit with bad news or something and they take it very hard. But this is an example of like you say, all right, my practice is not doing well, or you and Kay, like you did not join the other company when you got bought by the company. So it was like a collection of factors, but instead of like being sad about it or saying, oh, we can't do anything, life is bad, you actually collaborated together and created this a great cloud-based company that's very fast growing at this point. So I think you made things that went bad, they made them much better over time. And this is a great example of like how collaboration, hard work can help. So thanks to you both for being on the podcast, and hopefully we'll hear more about your software and we'll see a lot more growth in the future.
Thank you
Thank
so
you
much.
so much for having us.